En route to scene, possible cardiac arrest. We're going to be in an inside environment, so there shouldn't be any environmental or weather factors to be concerned about. It's easy access. If we do need backup, it should be able to find us. Unaware of any bystanders to manage. You feel comfortable proceeding? Excellent. If we do need to do a resus, I'll take lead and you'll be my offsider, okay?
Yep.
Excellent. Right, coming in. Patient looks poorly diffused, unaware of our presence. Can't see any signs of respiratory effort. Hello, sir. Can you open your eyes for me? Excuse me. Okay, non-responding to pain or verbal stimulus. I'm just going to check the airway for any obstructions. No visible signs of obstructions. Also no visible signs of bleeding or any trauma. I'm going to check for breathing, for look, listen and feel for 10 seconds. Okay, he's not breathing. Dane, can you please start compressions? Please call for backup. We need an intensive care paramedic. Possible cardiac arrest R50. Just going to work around you, Dane. Keep doing what you're doing. Just deep compressions.
Analyzing heart rhythm.
Stand clear.
Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Alright, stand clear.
Deliver shock.
Shocking.
Now. Press shock delivered. Pause.
Resume compressions.
Start CPR.
I'm going to place a towel under the patient's neck to help keep airway positioning. Thank you. Retrieving bag valve mask. Attaching to oxygen bottle. Setting at a minimum of 10 litres per minute, up to 15 to keep the bag inflated.
30.
Chest rise, chest rise. Squeezing the bag 1/3 depth to avoid gastroinflation. I'm going to insert an OPA to keep the airway open, measuring from the corner of the mouth to the mandible. Chest rise, chest rise. Inserting OPA upside down, rotating 180 degrees. Can cause soft tissue damage or induce vomiting if PCS is high.
20.
Lubricating NPA. CE grip on bag valve to ensure extra seal. Would not insert NPA if base skull fracture suspected. Can be difficult to insert if nasal polyps present. Also can cause bleeding.
20. 5, 6, 7, 8, 9, 30.
Chest rise, chest rise.
Stop CPR.
Stop. Then I'll just get you to swap
Analyzing
positions
heart
with
rhythm.
me.
Stay clear of patient.
You remain in control of breaths.
Analyzing heart
If you
rhythm.
could count
No
my
shock
compressions for me.
advised. Pause. If needed, start CPR.
11, 12, 13, 14, 15,
Excuse me, did you call the ambulance?
16, 1, 2,
Yes.
3, 4, 5.
Did you see what happened?
No, I didn't.
Okay, do you know this man?
No, I don't, sorry.
Okay. How long has he been like this?
Approximately 15 minutes.
Alright, and did anyone perform CPR before we arrived?
Not to my knowledge.
Okay, thank you. Just continue until the AED instructs us to do otherwise. It's good, good chest rise. Dirty.
Stop CPR. Analyzing heart rhythm. Stay clear of patient.
Okay, checking the first responder kit. In the outside lower pocket is miscellaneous objects. In the outside upper pocket, you've got your stethoscope, your adult and child BP cuffs, clothing shears, a blood glucose monitor, and thermometer, as well as sometimes the pen light. In the large side pocket, this is your hemorrhage kit, so you've got triangular bandages, combat dressings, your tourniquet, your steri strips, different sizes of gauze, 2 different sizes of tapes, and saline ampules. On the other side, you've got your upper small outside pocket, which has your cold spray, epiphysis bag, your suspected spinal injury lanyard, and protective masks. Then in that lower pocket, you've got your 500 ml of glucose, your 60 ml syringe, oral glucose, and glucogen pen. Then inside upper pocket is where the medications are, so you've got your Penthrox inhaler, ibuprofen, paracetamol, tramadol, and loratadine. In the middle pocket you have forceps, the various sizes of OPA, 3 sizes of EPA, biohazard bag, and disposable laryngeal scope, as well as lubricant. On that lower pocket is where the excess tubing and nebulizer mask is, and you have adrenaline and medications to be used for the nebulizer. On the inside we have our child bag valve mask and our adult bag valve mask. We have cardboard splint, a C-collar, towels, sharps kit, as well as slippery sand, and the 1000 mils of saline. There's the LMA kit and the IV roll. Doing an oxygen check, making sure that the bottle is white, sometimes white and black, and clearly labelled oxygen. Checking the regulator, an intact Bodax seal and prongs. Placing the regulator over the top of the oxygen bottle. Just inserting those prongs into the holes provided. Screwing tight, quarter turn. I'm going to turn on the oxygen bottle and check the gauge to ensure that there's enough oxygen, preferably above 1500 psi or in the green. Turning on the flow gauge, adequate oxygen flow there. I'm going to use a bag valve mask. Just checking that my bag has no leaks. By sealing it up, there's no escaping air. Attaching a filter and face mask. Putting on the oxygen tubing to the bag and the O2 bottle. Going to have it on at least 10 flow rate up to 15. That reservoir bag should inflate and then it's ready to use. I'm going to turn off the flow gauge meter, close the bottle, turn on that flow gauge to release any excess oxygen and return back to 0. To test our suction unit, we're going to squeeze the tubing, turn the power on full, pressing the testing button. Those lights should go all the way up. And then you know it's fully functioning and the battery's fine. When suctioning a patient, they should always be placed laterally. You will suction as far as you can see and only on the way out. Going into the cheek cavity in a circular motion. Suctioning can cause soft tissue damage, and a stiff catheter such as this would never be used in a moving ambulance. You would only be using soft catheters in those circumstances. A check of the life pack, turning it on at the top there.
Push analyze.
Going to get out of the AED mode, go into manual mode. I'm going to run a user test. That'll just take a second to do that, so I'll go through and make sure that all of the equipment is here. In this pocket we should have the test load and the cables for the defib pads as well as the 12 lead, a razor, glycerin spray and some paracetamol. Put those away. On the top we usually have sensor pads and the O2 monitor. And in the very back pocket there is our adult and child size blood pressure cuffs. Underneath there you have the battery compartment, and we can check whether those have battery or not on the screen of the monitor. This side pocket is extra printer paper, and our 3-lead cable is tucked away in there as well. Okay, our test result has come back as passed, so that's fine. I'm going to run a test shot, pressing charge up to 360 joules. Shocking. Shock is being delivered. I can also choose to abort that and dump the load. We can change onto our defib cables like so, and if we chose to, we could attach the 12 leads onto the 3. I can go through and change my leads on here, as well as my ECG size. Okay, I can change the alarm volume, so forth. To get back into my AED mode,
Connect electrodes.
press analyze.